In this video, we will explore the diagnosis and management of bile duct stones. We will cover topics such as stone formation, anatomy variations, endoscopic techniques, complications, imaging methods, treatment options, and long-term outcomes. This information will provide medical students with a comprehensive knowledge of gastroenterology. Bile duct stones form due to factors like bile composition, stasis, and genetics. The two main types are cholesterol and pigment stones, with cholesterol being more common. Imbalances in cholesterol secretion and genetic polymorphisms can contribute to stone formation. Studying the molecular mechanisms can aid in developing treatments and prevention. Bile composition is important in the development of bile duct stones. Factors like cholesterol saturation, bile acid pool size, and nucleating agents affect stone formation. Cholesterol supersaturation occurs when cholesterol concentration exceeds its solubility, while pigment stones result from excess bilirubin. Understanding the relationship between bile composition and stone formation is key for interventions. The biliary system exhibits significant anatomical variations, which can complicate the diagnosis and management of bile duct stones. Anomalies such as aberrant bile ducts, cystic duct variations, and accessory hepatic ducts challenge the conventional approach to stone extraction. Accurate assessment of biliary anatomy, using techniques such as cholangiography and MRCP, is essential for appropriate preoperative planning and selection of the optimal therapeutic approach. Moreover, familiarity with these anatomical variations is crucial to mitigate the risk of iatrogenic injury during intervention. Endoscopic retrograde cholangiopancreatography, ERCP, remains the cornerstone of therapeutic procedures for bile duct stone management. Mechanical lithotripsy and laser lithotripsy are two advanced endoscopic techniques utilized for the fragmentation and removal of large and impacted stones. Mechanical lithotripsy involves the use of specialized devices to crush stones within the biliary system, whereas laser lithotripsy employs laser energy to fragment stones into smaller, more manageable fragments. These techniques offer effective alternatives to surgical intervention, providing patients with improved outcomes and reduced morbidity. While ERCP is generally a safe procedure, it is not without risks. Complications associated with ERCP include pancreatitis, bleeding, and perforation. Pancreatitis is the most common complication, with factors such as the presence of bile duct stones, sphincter of Oddi dysfunction, and difficult cannulation contributing to its occurrence. Various management strategies, such as early recognition, aggressive fluid resuscitation, pain control, and in severe cases, endoscopic or surgical intervention, should be employed to mitigate the morbidity and mortality associated with these complications. Magnetic resonance cholangiopancreatography, MRCP, is a non-invasive imaging tool that uses MRI to examine the biliary system. It provides important information about bile duct stones, their location, size, number, and associated anomalies. MRCP aids in preoperative planning and post-interventional follow-up, making it crucial in managing bile duct stones. In cases where endoscopic approaches fail or are not feasible, interventional radiology techniques provide alternative options for the management of complex bile duct stones. Percutaneous transhepatic cholangioscopy, PTCS, involves accessing the biliary system through a percutaneous route, allowing direct visualization of the stones and subsequent extraction. Balloon dilation is another interventional radiology technique used to relieve biliary strictures and facilitate the passage of stones. These minimally invasive procedures offer additional therapeutic avenues for patients with challenging bile duct stone cases. Pharmacological interventions have a pivotal role in the prevention of recurrent bile duct stones. Ursodeoxycholic acid, UDCA, is widely used due to its litholytic properties, which help dissolve cholesterol stones. This bile acid decreases biliary cholesterol secretion, increases bile acid pool size, and reduces cholesterol gallstone formation. Oral dissolution therapy, involving the use of medications such as chenodeoxycholic acid and monooctanoin, aims to dissolve cholesterol stones gradually. These pharmacological approaches offer non-invasive options for patients prone to recurrent stone formation. Concomitant gallbladder removal and management of bile duct stones require a comprehensive surgical approach. Laparoscopic common bile duct exploration, LCEBD, has gained traction as a minimally invasive technique that allows for the complete extraction of bile duct stones while maintaining the advantages of laparoscopic cholecystectomy. With the advent of robotic surgical systems, robotic-assisted approaches have also emerged as an alternative for the management of bile duct stones. These techniques offer the advantages of improved visualization, enhanced dexterity, and reduced morbidity compared to open surgical approaches. ERCP is important in treating acute gallstone pancreatitis by removing bile duct stones and improving biliary drainage. The timing of intervention, based on disease severity and risk of complications, affects patient outcomes. Early intervention can decrease the severity and recurrence of gallstone pancreatitis. Bile duct stones can adversely affect liver function, leading to hepatocellular injury and impairment of liver biochemical markers. Liver biopsy findings in patients with bile duct stones may reveal biliary changes, cholestasis, and periportal inflammation. Elevated liver enzymes, such as alanine aminotransferase, ALT, aspartate aminotransferase, AST, and alkaline phosphatase, ALP, are common laboratory markers indicative of hepatocellular injury in the presence of bile duct stones. Understanding the impact of bile duct stones on liver function is crucial for appropriate disease management and monitoring of disease progression. In a video about bile duct stones, we discuss the importance of evaluating long-term outcomes of different treatments. This includes recurrence rates, quality of life impact, and cost-effectiveness. These factors help healthcare providers make informed decisions for optimal patient care. In conclusion, managing bile duct stones involves understanding the causes, diagnosis, and treatment options. This video covers all aspects, providing medical students with the knowledge to diagnose and care for patients with bile duct stones. Ongoing research will lead to better outcomes in the future.